The next study of the head is the percussion. Since the head is located on the diaphragm, we must first determine the right lower border of the lung, or the diaphragm. Start from the second edge percussion from top to bottom. The sixth rib is normally determined. Above the sixth rib, fifth intercostal space, we jump over the fifth intercostal space, and in the first intercostal space, we find the right border of the relative cardiac dullness of the head. Fingerplasimeter of the left hand is superimposed on the first intercostal space, and fingerplasimeter is placed parallel to the right border of the relative cardiac dullness of the head, medium percussion. Where the sound is shortened, we mark the border. Normally, the first intercostal space is 1 cm outward from the right edge of the sternum. The left border of relative cardiac dullness coincides with the apical impulse. If we find an apical impulse, then we can mark the left border. If the apical impulse is determined hard or poorly, then we should use the percussion method in the fifth intercostal space, starting from the anterior axillary line to lead percussion to the head. Raise your hand. Note the left border of the relative dullness of the head. Now the upper border of relative dullness of the head we determine starting from the second rib, retreating 1 cm from the left edge of the sternum in normal third rib. Then we determine the width of the vascular bundle in the second intercostal space on the left and right, starting from periclavicular lines. Quiet percussion method found the width of the vascular bundle in the norm of 5-6 cm. After that, we find the boundaries of the absolute dullness of the head. Starting from the boundaries of relative dullness inwardly, we percuss it by the method of quiet percussion. Normally, the right border of absolute dullness of the head is in the first intercostal space, runs along the left edge of the sternum. The left border of absolute dullness 1-2 cm inward from the borders of the relative dullness of the head. Upper border, starting from the upper border of relative dullness inward, normally first intercostal space. Thus, we attribute this area to the absolute dullness of the head, that is, the lines not covered. Then we determine the configuration of the head. This requires additional points on the right. This is the third intercostal area, and on the left, the first intercostal space found. On the left is the first intercostal space. We also find an additional point. Connect these points, we get the right and left contour of the head. The next stage, after determining the boundaries of the head vascular bundle, absolute dullness, we proceed to determine the size of the hat. There are two sizes. This is the length of the hat. We start from the right border of the vascular bundle to the left border of the relative dullness of the hat. We measure this distance, normally 18-20 centimeters, and next the diameter of the hat, this point of the right relative dullness of the hat to the middle of the sternum forms the left border of the relative dullness of the hat to the middle of the sternum. Add these two segments, we get the diameter of the hat in the norm of 11-12 centimeters.